Hey guys, welcome back. I'm Marisa Personius. I am on with my friend Quyen Vu today. She had Ewing Sarcoma, and there's not a stage for it, but it was very aggressive, and she's going to tell us her story. So, welcome, Quyen Vu.
Hi.
Hey, Quyen.
I'm Marisa. What's up?
Not much. I'm just excited to hear your story and share it with everybody else.
Nice.
Yeah.
Glad to be here.
Yeah, happy you're here. So, how about you start us off with telling us about, how you found out that you had cancer? How'd you get diagnosed?
Yes. So basically I was a junior in high school. So this has been a hot minute. It's been a little bit of a while ago. As I'm 31 now. But my junior year of high school, I felt like something was something was wrong in the back of my jaw. Like I felt like maybe it was my wisdom teeth growing in or something that, you wouldn't think that's cancer. But basically, yeah, that happened for I would say like a few days. And then I went to the dentist and the dentist was like, oh yeah, it's probably just your wisdom teeth growing in. And then we had to wait to get approval to get my wisdom teeth pulled out. But in that time frame of I want to say 2 weeks, I actually had to go to the emergency room because it was just so painful and I was drooling a lot because it just wasn't normal. Maybe we thought it was an abscess of some sort. And so we got to the emergency room and they were like, yeah, it's probably just an abscess. So they gave me a shot of antibiotics and they sent me home. And then about a few days later, about a week or a few days later, I was like, yeah, I don't feel good. Like it doesn't feel right. And so, and so we were just waiting around at home and then it started becoming really painful. And so at this point we were like, it's probably not an abscess or my wisdom teeth growing in because it was definitely different. So then my dad actually took me back to the emergency room and while I was waiting, it started bleeding profusely. And chunks of blood was coming out of my mouth as well. So definitely not normal. And so I was just laying there and then we're just waiting for a room at that point because they couldn't really tell us what was going on because they didn't know either. And so we just waited and then I got a room and then they were gonna go biopsy it, and so they were like, okay, you're gonna go under and we're gonna biopsy you, and that's about it. And so I was like, okay, that's it, all right, cool. And at this point, no diagnoses, no nothing yet, just we don't know what's going on with you, but we're gonna try to find out. And so I was put under for anesthesia to get the biopsy out. But I actually woke up 2 weeks later.
What?
And I know. So they put me under anesthesia. And because they saw that it was a mass while they were in there, they were just so unsure of where it was going, because it was already going outwards, but they didn't know how far back it went. And so they did an emergency tracheostomy and they put me under so that I was more comfortable, I guess.
What is the emergency? What did you call it?
It's a tracheostomy. So it's when they put a tube right here, so that you can breathe, because your airway might be blocked. So therefore, they put a tube down your throat so that you can still breathe, but it's just instead of out of your mouth, it's out of this tube.
Okay, so kind of gnarly.
Yeah, and then they also put me on the ventilator because it's precautionary, to put me on the ventilator too, because they wasn't sure if I could breathe on my own. But when I woke up, my family was like, "Yeah, you kept on fighting the machine, so they took you off of it actually, because you kept on breathing against it, because it's supposed to breathe for you, but because I kept on breathing for myself, I was breathing against it, which is
Weird.
yeah. So, so then they woke me up and I had no idea where I was or what day it was. And my sister was there when I woke up and she was like, you need to calm down. And I was like, what is going on? And mind you, when you wake up with a tracheostomy, you can't talk because the tube is in your throat. And so you can't talk. You just wake up 2 weeks later, I can't talk at that point, and I can't move my legs really because your legs turn into mush like jello when you don't use them for like 2 weeks. So you have to, so like nothing works, and so you're just like, what's going on?
That's
And yeah.
that must have been so like scary and confusing.
Yes, it was definitely, it's like when you wake up from a dream and you're like, "What?" But it's real life. Um,
What no, were you in a coma technically?
yes, it's an induced
Okay.
medical coma. So yeah,
Wow.
technically I was in a coma, but like it was on purpose though. So and then so at this point, they still didn't know what it was,
Mm.
because they sent the biopsy out to several like local labs in the area, like the schools. So like UCLA, um, yeah, I was at UC Irvine, so UC Irvine and like a bunch of other places. So yeah, so then what else did they do? So yeah, so when I woke up, my sister was there and I didn't know what was going on, what day it was, and she's like, "It's 2 weeks later. You were in a coma. You need to calm down though." And I was like, "Okay, but I can't
Mm.
talk, and I can't communicate with you." And she's like, "Okay, here's a board. Write out what you need to say." And like, of course, you're still like disoriented, and so like my writing was super messy. And she's like, kind of knew what I was saying, but also kind of didn't. So that was very frustrating.
Wow.
Yeah. And so that was the first couple days. And then like a few days later, they teach you how to like rewalk. And so I had to like learn how to walk again. Literally, it was so weird. It was like your legs didn't work because you were laying down for so long. Um, yeah. And and then about, I want to say 1 to 2 weeks later, they finally figured out what it was. And they were like, "Yeah, it's an Ewing sarcoma. However, our hospital isn't equipped to treat you, so we're going to transfer you to CHOC Children's in Orange County." So yeah, so I was transferred over like by an ambulance, I believe, and that's where I met one of my main doctors, who was Dr. Newdorf at the time. And yeah, and then we immediately, like right when I got transferred, I got put on chemo like right away.
Now,
Um,
did they explain what Ewing sarcoma is or what it typically
mhm.
affects?
Yeah, so Ewing sarcoma typically affects males,
Okay.
and it usually affects your limbs. So it'd be a leg or an arm usually. So because it was in the back of my left mandible, like my left jaw,
Mhm.
that's why it was so hard to like figure out what it was too, because like it's just so rare that like it would even be at that spot.
Wow. And
Yes.
it did they have any explanation for why it was there?
Nope. Because I don't have a family history of cancer either, so it was just pretty random. So
So
yeah.
strange that
Yes.
it mostly affects males and it mostly affects the limbs,
Right.
and then you get it in the jaw
Right.
area.
Exactly. But it's still a bone
Oh.
cancer, so I guess your jaw is, it's made out of bones. So yeah, so
Yeah,
it's possible.
okay. Okay,
Mhm.
so then you went to chalk and they pretty much started treatment right away?
So at this point, so it started off as like a super tiny, small, like little, like inflamed tissue, right? And then by this point, it had grown to the size of like a baseball, and it like covered my entire mouth, like
Mm.
it was like a ball in my mouth of like,
Mm.
I don't know, of a cancer ball, right? So like whatever's inside a cancer ball. So like it was just
What?
like, yeah. So it covered my entire mouth. And I couldn't close my mouth, and I had to like wear a mask to like cover it because like I was so gross looking. Like
Did it cover your mouth from like the outside of your skin?
the inside. So like
So you
your cheek tissue and your gum
okay,
tissue, it's like
okay.
just super expanded and like
How so could you breathe or eat food?
no. So I was on enteral nutrition, so like through your veins
Okay.
at this
Uh,
point, or
did they
parental.
did they put you back on a ventilator? Or,
No. So because you have the tracheostomy, or I
mhm.
had the tracheostomy, I can still breathe on my own.
Okay, but it was through
Yeah, like it's like a
your throat.
little, yeah, it's like a little thingy, like a little tube, I guess, that sticks out so that you can
Okay.
breathe. hmm I
Okay.
mean, but really, they didn't know how deep it went, so maybe I could have still breathed through my nose, but we don't know because I felt like I still could breathe through my
Mhm.
nose. But like,
Yeah.
but I was breathing through like both holes, I guess, my nose and like the trach.
What's going on in your mind at this point when this thing has grown to be like a giant ball in your mouth?
Give me a second. Sorry. My doggy little. So at this point, well, mind you, I'm still 16, right? 16 and a half, a little bit, almost 17, right? Yeah, about that. And so the main thing is like I was just like, oh my God, like I look so gross right now. Like, what? Like, is this gonna be permanent? Like, is it gonna disfigure my face? Like that was like the main thing that I was concerned about. Not of like dying or like not making it, but like just of like thinking like, shoot, like I don't want to live like this.
That's very like scary to be faced with.
Right. And like because I was in the hospital for so long and like because like you don't bathe while you're like in a coma, they just kind of sponge bath you, so like my acne was like all crazy too. And so I was like had a bunch of acne on my face and I had this thing growing and I couldn't walk really, right? And so I was just like so like dismembered. I was just like, what the heck happened in the last like 3 weeks that like we went from like normal to like
Yeah.
now not normal.
Yeah.
So super aggressive.
Oh my gosh. And were the doctors like positive or did they say much?
Yeah, they just said, this is the action plan. And basically what we did was we did a bunch of rounds of chemo first to shrink it down to its original size. So like in that process, I was on a trach for most of the time, and then they did take it out for a little bit and they put it back in. Like it's been a minute, so I kind of forgot like exactly what happened. But I know I had the trach, and then we did chemo, and then it swelled down, and then so I went from like being like fed through a tube to eating because I could then eat. But right when it got to surgery time, I had to get on like a tube feed because they had to wire my mouth shut after the surgery.
Oh my gosh.
Yeah. So then once they got the tumor down to like I don't know, like probably like an inch, I would say. We did a full resection of the left mandible, so they like split it. They like flip. I looked up like pictures on Google, and like they literally like flip your face and like take out your jaw, and then they replaced it with my fibula and some titanium metal and like some cartilage for my rib. So yeah, so then they did that, and then I was in the hospital for like another like very long time, a couple months, or like a month and a half. The initial hospital stay was like 3 or 4 months straight. Yeah.
It's hard for me to imagine being in the hospital that long because I think I was only in the hospital for a week at a time.
Right.
And that to me was, it felt torturous. I feel bad.
Right.
I feel bad saying that, but
Right.
I can't imagine being there for months,
Like, well, at Chalk Children's, they were so nice. So it's not like an adult hospital, right? Like Chalk Children's are like super nice and accommodating. They give you like stuff to do, and like even if you're not like up to do it, like but there's like the option of that. And like that wasn't the worst part for me. Like like I was like, it's fine. I mean, where else am I gonna go?
What
uh
what would you say the worst part was?
The worst part for me was probably going through all of like the physical changes of having cancer, I would say. Definitely. That was like super hard on me. Just being an awkward teenager already, right? And then adding all that on and then like trying to figure out your life and like trying to be quote unquote normal still. That was the most difficult for me because I didn't want people to feel sorry for me. I didn't want people to think of me differently, but obviously there was something going on, right?
Yeah.
So yeah, and like not being able to see my friends, and like not being able to experience having the full teenage experience of like doing things. That was definitely hard, I would say, were the harder parts.
Yeah.
Yeah.
Did you struggle with like depression during that time?
I don't think so. I think I was more so like just in a mode of like surviving and like, being like positive and staying positive so that the people around me didn't worry as much. Because that was
Mm.
something that I was also concerned with, right? Like it's not only affecting myself, but it's affecting everyone that loves me and like taking care of me, and like I felt more of like a burden on them, right? Because like when I was in the hospital, someone was with me 24/7, like one of my siblings or my parents.
Mm.
They like wanted to be there for me. But
Mm.
as I got older, right when I turned 18, I was or like around 18, I was like, okay, I think I'm good, guys. Like you guys can just leave me here. Like it's okay. But like the entire time, like I was feeling guilty too, that like they had to take time out of their day to be there for me.
Mm.
But like ironically, like I would do the same thing for them. But like receiving that was, you know,
It's kind
I
of
don't know.
hard.
Right. Right.
Yeah. Like you don't want to feel like you're a burden, but
Right.
I'm sure your family was,
More than
it's like,
happy, like, to be there with me.
yeah.
I know. Yeah.
So, all in all, how long was your treatment?
Oh gosh. So we did chemo for like a year, right? And then we did surgery for that took a little bit of time. And then right after actually, I'm sorry, I take that back. We did radiation, then surgery, then more radiation. Because yeah, we split up the radiation in 2 rounds because I couldn't handle it. It just burned the insides of my mouth like so much. Like it was that was the worst like pain I would say out of everything was the radiation. Like yeah, like you're like I couldn't taste anything because my saliva glands and like my like taste receptors were all like shot after the radiation treatments. Where like I my sister gave me a spoonful of salt because I was like, I just want to see if I can taste it, and I couldn't taste it at all. It was crazy.
Oof, wow.
And your sense of smell too, like super, it changes a lot. Like when I smelled like coffee, it smelled like poop. Like no, like
No,
we
thank
went.
you.
No, thank you. Yeah, like we went into a Starbucks and I was like, no, thank you. I don't want anything. I'm good, thanks.
Oh my gosh, that would be so hard. It's like I love
Right.
eating, I love.
Right, exactly. Same.
Oh
So
man.
yeah, and like the long lasting effects of radiation is like the thing that I also feel the most. It's so like my saliva glands on my left side are like not as good, like they don't work as well as like my the other side. So
Hmm.
I have like so I sometimes get like a little bit of dry mouth, and I sometimes get like yeah, like mostly dry mouth, or like I like choke on my spit a lot because I feel like I'm not making enough sometimes,
Yeah.
Yeah, it's super, it sucks, but it's not as worse as it could be, because I know for some people, like your saliva glands are just shot forever, and like they don't come back at all. So
Okay.
at least we're kind of working.
Yeah. Are there any other side effects that you have?
Well, because I was going through treatment right when I was gonna start college, or like I just finished my treatments and I was just like under like maintenance at that point when I started college, I had to go to community college first instead of like actual college. But I think it kind of worked out in the end because you still get your degree, and like at the time I was kind of unsure of what I wanted to do too, so it gave me a chance to figure out what I want to do.
Yeah,
But, like,
that makes sense.
learning-wise, because I was homeschooled for the last, like, year and a half of school, like, I couldn't remember anything, and, like, because my math skills were already not the greatest to begin with, but, like, when you're not studying at all for, like, a year, and then, like, you get put into, like, a math class, you're just like, "What is this?" Like, I can't even. Yeah, so I started from, like, the lowest math class possible in college, and then I worked my way back up again because I just couldn't, like, I couldn't think, like, it was crazy. I was like, "Wow, I feel so, like, useless."
Yeah, it's a mixture of chemo brain and having not done,
Right.
math
Any math
for,
for, like, a year and a half. Mhm.
yeah, use it or lose it.
Exactly.
Well, so you look great. Obviously, that amazing surgery that they did worked out wonderfully.
Yeah.
Um,
Thank you.
How was that process? Was that
So after the initial surgery, I've had one other surgery to reduce the scarring on the inside of my mouth, just because of the way the tissue healed. And so far it's been fine. Yeah, I mean, like, I don't have my back molars, they had to also take out, like, during surgery, just because they had to remove the entire jaw, right? I'm missing 2 of my back molars, and then I'm missing, like, a top molar as well, which sucks because like, I, like, eat on, like, one side of my mouth, but, like, that's fine, I guess.
and I
Um,
I imagine you were on a smoothie diet for a while.
I was on, yes, soft food smoothie diet for a while. Yes, I was. That was fun.
Yeah.
But yeah, like, I mean, and I do have like facial paralysis, like right here. I could feel like a light touch, but like if I get like food stuck on me or something like that, I don't feel that. And so it's kind of embarrassing sometimes, right? Like you're just like walking around, you're like, hey, and they're like, you have a little, and I'm just like, oh, thanks, I can't feel that.
You'll have to
um,
you probably get used to like
yeah, like
wiping
I'm always
after.
like, is there anything on my mouth or on my chin?
Yeah.
Because I can't feel that. But yeah. And then I did actually just get some like prosthetic dentures for for my bottom teeth. Like we talked about possibly getting implants, but there was just so much surgery involved and the risk is so great. I was like, I don't think I'm comfortable um doing that again, honestly, because when you do get implants, the likelihood of them failing is also high, and
Mhm.
that would mean that I would have to get a new jaw again, probably, like the or like having complications with it. And so there's like, if you're okay with like not doing it, it's fine. I mean, you've gone this far without it. I don't they Yeah, my prosthodontist was like, yeah, I wouldn't recommend it. And so here we are.
Well, that's, with chemo, like with cancer and chemo, you already have so many of those decisions, which are
Right.
are kind of scary. There's chemo, there's radiation, and
Mhm.
so, if there's one more where it's not really necessary, like I can totally understand, just feeling like, no, I'm good right now.
Right. It just sucks because, like, for me, like, it's like the physical aspect of it, right? Like, I don't look like I yes, I look normal, but like I know that like, I'm missing some teeth on the back and like I know that like my face could be a little bit more symmetrical if I did get implants. But like yeah, it's just that's like another other aspect of like of it, right? Because it's cancer can be so physical that you're just like I'm grateful to be here about the same time. And I'm just like, if I did have cancer, my face wouldn't be as uneven. But yeah,
Yeah, it's all these
right.
things that are a part of it, and it's like, yes, I'm thankful, to be out of it and to be as well
Right.
as I am,
Exactly.
but, there's those things that you still think about.
Right. That
Yeah.
never like really go away. Like there's a gentle reminder that, hey, yeah, you were really sick one day or last a few years ago. So like be extra careful. Don't do anything. Don't do anything you might regret later.
Yeah. But
Yeah.
also a great reminder of what you've been through, and what you've overcome and what you can be
Right.
thankful for.
Right,
Um,
exactly.
yeah.
Yeah.
Well, what would you say is something that you've learned from this whole
Mhm.
process?
Mm, what have I learned from having cancer? Something that I've learned as a long-term cancer survivor is that the trauma of going through something this big can affect you years later, or you won't even like think about it until years later. Because while I was going through it, I had to keep like a happy face on, right? I had to be strong for not for myself, but like for my family too, right? Because they were also scared. They didn't know that I was going to survive or not. And so whatever happened, like I had to like put a brave face on and like pretend everything was okay. And like even if I was scared, I had to like not say anything, right? And so I started seeing a therapist like I want to say like 5 years after I was diagnosed, just because I was feeling a bunch of anxiety all of a sudden and like kind of like panic for no reason. And she linked it to it's the PTSD of having cancer, and like just worked through my feelings and like talked through it because I didn't have a space to talk about it while I was going through it. And so yeah, and like, while I had cancer, I didn't tell anyone about it. I didn't say anything about it. I didn't mention it. Each time anyone like asked me anything like, "Oh, why are you wearing a wig?" Like that's so like for a random person to ask that, or even anyone really, that's very like you shouldn't do that, but people do that, right? Like they'll come up to you and be like, why are your eyebrows shaved off? And I was like, I literally lost my eyebrows. I don't think anyone would shave off their eyebrows purposefully. And so, yeah. And so that was, I would say like what I've learned is, the, the trauma can surface later on. And it's something that's super important to like explore and look into if you are going through cancer or if you think you're fine. It's always beneficial to talk it through with a therapist, a licensed professional.
I totally agree. And
Mm-hmm.
in a way, that's advice for other people out there, right? To share with, a therapist and get things off their chest.
Mm-hmm. And it's also helpful if like your therapist is familiar with the cancer world. Mine was a licensed social worker for cancer patients before she had her own private practice, and so she was really familiar with like what people go through as a cancer survivor. And so we just really clicked really well, and like she's still my therapist to this day, and I see her probably I think next week. So yeah,
that's beautiful.
I
love that.
I know, I love her. So if anyone
Aww.
needs one, let me
Yeah.
know. I can give you her info.
Yeah. That's so great. Okay, well, Quyen, I have loved this so much. I really appreciate you coming on and being so open and vulnerable and sharing your stories. And maybe there's someone out there who, has Ewing sarcoma, and maybe they're just starting and this will
Yep.
be a benefit to them. So
Yes.
thank you so much for sharing.
Of course. Thank you for having me.
Yeah. And thank you everyone out there for watching. Please, if you know anyone that you think would benefit from this video, go ahead and share it with them. That's what this is all about. And other than that, thank you for watching, and we'll see you guys next time.
Bye.
Bye.